I've never ever lost the feeling that it's a privilege to be invited into somebody's home. As a nurse, we don't have limitless time to spend with patients, sadly, but I do like to get to know them, and I'm very aware that sometimes I'm the only person that they see all day long.
I am finally living the life I wanted to live. I'm doing the job I love, helping others. I am able to use all my personal experience, and it's giving me so much joy and satisfaction. My son and daughter say to me, "Mom, you are like a new person." And that is certainly how I feel.
I'm Rod Bryant. I'm a long-term conditions practitioner and I work in Faversham. I work alongside the Faversham NCT, that's the neighbourhood care team, and the ICT, which is the intermediate care team, and we work together as a group, managing people with long-term conditions. My role as a long-term conditions practitioner is to see people in the community who are living with long-term conditions and to try and help them manage their condition so they have a better quality of life. So, for example, with Joyce, she has several long-term conditions, and what I did was, in partnership with Joyce, we worked together to create a care plan that was suitable for Joyce and her daily living, and also to help her manage her conditions.
I started out as an apprentice in September 2014, and then I got a normal band 2 position in March 2016, and I've been in the same job since. I wanted to stay because I felt like I could progress so much more than what I'd already have done, and I enjoyed working with everyone and what I was doing, so I just didn't really want it to end there. There's a lot of training opportunities available. So far I've had minute taking training. That's really helped me because recently I have done minute taking. I think the Trust is a really good place to work because you get a lot of support from everybody. You have the opportunity to develop your career, which I have. You develop life skills, and I think it's really important that you enjoy where you work, and I really enjoy where I work.
It's always been a good idea to share thinking, to work in partnership with each other, collaborate, but the recent austerity has created an imperative that we must do this. That hopefully will drive that, and in partnership, it's really important that people understand each other, they learn to trust each other, because at the end of the day, we are all trying to provide the best quality and quantity of services that the community needs in Kent.
Integration has been a word that's been around a long time, and we've all talked about it and actually have a long track record of doing very little about it. The work we've done with Kent Community Health is, I think, a vanguard in terms of ways in which you can move that forward, but it's not enough on its own.
I've been here now just over 6 months, and in that time I think I've seen a real change. Not necessarily on the ground yet, because I think that takes a bit longer, but where I have seen a real change is in the conversations that are happening between the two organisations. There's a massive commitment board level in both organisations, but importantly, more importantly probably, a real commitment operationally to see these changes happen. People want to do these, to change the way that we work, because they know it's better for patients and it's better for the organisation, it's better for the NHS.
During the last financial year, we partnered with Kent Community Health in terms of a bid for community services in Dartford and Swale. Though unfortunately that bid was unsuccessful for both of us, what it did was really generate a feeling of working together between our two organisations.
I had a stroke 2 years ago. I went to my doctor to ask for an exercise referral to become stronger. So for my recovery, I go to the gym 3 times a week and I have a personal trainer. I do an hour's workout on different cardio exercises and a few on my arm because I can't use it, so it's to strengthen it.
Lizzie's lovely because she's on the younger side. We generally see older clients. Lizzie's only 21 or 22 and was referred to us for a stroke. When she initially came, it was really about confidence and building up her confidence and gradually getting her back into exercise to help strengthen the muscles, to help work on the fatigue side of things, but really to give her back the confidence to come back into the gym and start living her life to the full again. We get a really large support from Kent Community Health really because they act as a conduit for the referrals, so they match up with the referrers, i.e. the consultants, GPs, physios, with the referring centre. They also give us training, they also support, they come out and assess the centre to make sure that we reach the criteria, but really they're just there as a sort of font of all knowledge for us to ring if we need any help.
As a complex care nurse, we proactively manage people in the community, patients in the community, with long-term conditions. What we do is we have a management plan and a personalised care plan, which then empowers people to take control of their long-term condition. I think it's really important to be able to keep people in their own home environment. It's where their heart is, it's where their memories are, and it's where they want to be. I think that people are much better off in their own homes in terms of social factors and also for their own safety and well-being.
My name's Anthony Allsworth, but people call me Tony, and I'm 77, and unfortunately I've got a lifelong illness. I don't know where to start actually, because I've had so much help. And Jane seems to be my first point of call, and to know that she's there, and she is there.
Since meeting Tony, I've known Tony now for a good 9 months. I've seen him flourish and grow in his looking after his condition. I think it has definitely empowered him to take control of his condition, and his health has definitely improved. In fact, having taken a recent blood test for blood glucose control, which is the HbA1c testing, it's significantly dropped. So we've seen a real good improvement. I really do believe that as a complex care nurse, I'm in a real privileged position to be able to offer that patient a real unique and proactive service. At my last visit with Tony, I said to him, I praised him for everything that he'd achieved over the last few months. And he said to me, we did it together.